Workspace Provision Co., your spot to create, connect, and grow. Flexible offices and event spaces made for entrepreneurs and dreamers. Come see what's possible. To learn more, visit workspaceprovision.com.
A business hub where you can go. It's a Workspace Provision Co. A business hub where you can go. It's a Workspace Provision Co.
My name is Grant Paxton. We are here in the Bonsai podcast room of Workspace Provision. I am here with Miss Courtney Barrett, Dr. Courtney Barrett, rather.
That's all right.
No?
Courtney's just fine.
Courtney's just fine. Okay.
Yeah.
Some folks that have a doctor are like, listen, it's not Miss or Mrs., it's Doctor.
I'm not one of them. You won't find out with me.
I'll still go with Miss Courtney. Is that okay?
Oh, that's fine.
Okay. So, Miss Courtney, you are the owner/operator, I guess we call it, the primary person of primary care. Your company is True Insight Direct Care.
Correct.
And I'd like you to start off by bragging about yourself a little bit. Tell us, who is Miss, not Doctor, but Doctor, Miss Courtney Barrett?
So essentially, our office is comprehensive primary care, like you would consider it in an office setting, but it takes insurance out of the ballgame. So when you take insurance out of it, it's a lot more affordable. And because of that, I have time with patients. So I guess the main theme of it is time. It's all-inclusive care. So it's a monthly membership-based program. And with that is annual visits, chronic care conditions, urgent care needs, everything from suturing to EKGs to nebulizers. If it's in the realm of primary care, like your physician back in the 1960s did, all-encompassing care for one low monthly membership, and with that comes time. So I have time with patients.
Okay. You have an office in Wake Forest?
Just outside of Wake Forest, on Durant Road.
Okay.
Yep.
Great.
Just outside.
Is that where most of your patients come to see you?
Yes.
Okay.
And they also do telehealth too. So that's a great benefit.
Telehealth is wonderful.
It is, for sure.
It's really nice, especially if you have like a minor cold or something. You kind of already know what you need, but you need to seek a little advice.
Yeah.
Without driving in. That convenience has been wonderful in medicine. Now, I've mentioned this too before, both in person and at networking events or groups that we do. My insurance is terrible. I'm self-employed. I'm a small business. When you are trying to get care, your insurance determines your health care. Your insurance determines what you need.
It really is a bottleneck. For sure.
How are you fixing this terrible anomaly, this situation we have with America's healthcare?
I love how gracefully you put that, Grant. So healthcare is really broken and the insurance dictates everything. That's why in the traditional system, you only have, 10, 15-minute visits because insurance reimbursement's so low that you need to see 20 to 25 people a day in order to keep the lights on to actually make enough income to pay the bills and pay the staff. And in addition, more staff to actually deal with the insurance companies. When you take the insurance out of it, it's a lot more simple. It keeps prices low. And I often tell people if they have insurance, I'll work with that. So everything from someone without insurance who can really benefit from like cash pay prices to those with high deductible plans. So insurance is billed at a certain rate. The corporate medicine typically will bill insurance and, the insurance negotiated rate for payment is somewhere here. And if you haven't met your deductible, you're stuck with that bill. Versus if you don't bill insurance to start with, you can start with a low cash pay rate. It's a huge savings.
Definitely. The folks that come and see you, I bet they are thrilled about the expense, the amount of money that they spend versus going to a doctor in network with insurance. Do you get a lot of good feedback?
Absolutely. Absolutely. And I like to play the game.
Yeah.
So if I know that insurance is going to cover, say, labs for an annual visit, I'll bill them labs that I know are going to be covered, and then I will do a separate order for labs that people can pay cash for, say risk stratification labs, or even things as simple as vitamin D insurance isn't paying for anymore. So to run those labs and pay cash, just a low, $20, $30 at a hoopla of labs that the insurance is going to reject, and then you can bill other labs to insurance and have them cover it.
Yeah. I'm going to shelf talking a little bit more about the particular cares that you provide, the services. I want to ask you a very broad, maybe difficult question. If you were to reform healthcare in this country, where would you start? Do you see lots of problems from a corporate standpoint of way too much being charged and whatnot? Tell me, Miss Courtney Barrett, aka Dr. Barrett, what you would do. What is your new healthcare plan? You're in charge of healthcare in this country.
I don't know if I want to carry that weight, but I'll
I
run
know.
with it. I'll
Yeah.
run with it, Grant. With that, honestly, I would always encourage someone to have that catastrophic care coverage. So in my mind, if you could get government to cover a broad catastrophic coverage for folks, a big illness or a big injury, a long hospitalization, and then leave everything up to cash payment so that you brought back competition in the market, a free enterprise in the market, I think that would really change the game. Direct primary care doesn't solve all the problems in the healthcare system, but it definitely solves a lot of them. It's actually one component when you think of politically that both sides agree on is direct primary care.
Fantastic answer. Couldn't have answered it better myself. If I'm ever in charge myself of the healthcare in this country, you will be my number one advisor.
I'll consult right with you, for sure.
Now, what about the different patients that you see? Do you have like a certain wheelhouse or demographic that you see? Maybe you can also dive in a little bit of the services or the types of illnesses or problems that you deal with on a day-to-day basis.
Honestly, it really is every range of the spectrum from, 20 some odd to I think my oldest right now is in their 70s. And there's not really any particular demographic per se, but one of the common themes I get is folks just frustrated and they don't feel heard.
Okay.
So they just don't feel as though in that 10, 15-minute visit, they can get their point across and the doctor actually is able to understand them completely and not be running right on the road to what's going to happen next, what are we going to do next, what medication am I going to toss that way kind of thing. Because that time variable, that's what I love about direct primary care, because I was always frustrated when I worked in the system that I didn't have the time with patients to truly get all the information, all the details of what's been happening, the chronology of it, what have you, and then to ask the right questions. You need to ask the right questions to get the right information in order to make a good, comprehensive medical decision or plan.
Very good. How many patients can you see? Do you have a full book? Are you accepting patients?
Oh, yeah, I'm accepting
Is it
patients,
just
but
you and your husband?
It is
Wow.
actually. It's
Okay.
a very just simple approach.
Yeah.
So it's like a home atmosphere. In fact, I joke around that our waiting room is the non-waiting area because you really shouldn't be waiting for me. And then also, it's just very, very direct. It's in the name, but if you call the office and I'm not with a patient, I'm the one answering the phone.
Right.
And if you call in the evening, on the Saturday, on a random holiday, I'm going to be answering. So you have that peace of mind
Yeah.
that a doctor truly is on your side on the other end.
That's amazing. You know how many times I've gone into the doctor's office, first of all, and waited more than I actually saw the doctor. That's frustrating, of course. But I feel like I'm re-explaining myself to the doctor every time I see them. Maybe it's not like that right now. I do have a doctor in the Wake Med circuit, but a lot of times I feel like they don't even remember who I am at all.
It's difficult.
That care, that attention that you offer your patients there's nothing to compare to that.
It really isn't. The average census for a traditional physician in the system is about 3,000. So that's 3,000 on their panel for inbox messages, for random visits, for getting their annual visit, things like that. And I'll cap at, I initially said 500, but I kind of gauge that that'll be more like 400 to 500 that I'll cap at. And so after that, it'll be a wait list. And the reason for that is because I want to maintain that relationship, that close, intimate relationship where, I pick up the phone and I can think of, oh, yes, I know about this. I know about this when someone's explaining what issue they might be having. And that allows me to still have time with patients.
Is there a specific program or organizational tool that you use or doctors use? How do you keep track of everybody and their problems?
The beauty of electronic medical records.
Okay.
And on the direct primary care side of things, there's actually a group of different, and there's more coming every day as far as the medical record systems, and they're designing it specifically for direct primary care.
Okay. Is there a particular specialty or illness or problem that you're passionate about that you want to cure? Or is there anything that you're like, yeah, I need to see that patient. That's my go-to?
Honestly, I'm bothered a lot by folks seeking out care. Like online platforms are booming right now.
Mm-hmm.
And people are paying gobs of money, monthly memberships for a weight loss program or a hormone program. Just the monthly fees of those are in the range of like $250 to $300.
Yeah.
And that's not even including medicines that people might be prescribed from them.
Wow.
And that's just people kind of falling into the trap of, spending more than they need to, even on programs that don't even work with insurance, and they're spending more than they need to, when direct primary care is a great option that is all encompassing, because I don't charge extra for hormones. I don't charge extra for weight management and all that. I consider it part of the person. If it's part of you and your health, I take care of it.
How do you charge your clients?
It's simply that monthly fee.
Okay.
So nothing else is on top of that.
Okay.
Certainly medications. I do have a generic pharmacy of about 50, 55 generic medications that are
Okay.
just passed along at wholesale cost. But when it comes to the visits, there's no treatment fees. There's no procedure fees. There's no per visit. It's unlimited visits for however many visits you need to accomplish the task and the goal that you're setting for yourself.
Okay. Let's say as a small business, I have 4 employees and I'm looking for a health benefit to offer my employees. Is your plan something the employer can pay for, and then
Absolutely.
my employees get a certain amount of care or parameters to follow every year?
Absolutely.
Okay.
It's actually something that we're working more and more with networking to partner with small businesses to save them that crazy headache of insurance. I heard recently it's going up 9%, Grant, 9% in
Yeah.
2026, which is beyond belief, but it's happening. And
Mm.
it's more and more unaffordable, especially for small businesses. But it's so important for small businesses to give some type of health or wellness benefit to their employees. They can attract better employees, they can retain them with those benefits. And really, individuals can sign up for the program as well, but for small businesses that want to provide a great comprehensive type of care, it's a great next option for sure.
What a great way to, in a sense, reform how healthcare is provided from employer to employee. That has been such a big expense as an employer when I've had employees in the past. And I want to be able to offer the best environment, the best care, a great jobs, an environment that employees are happy with and thrive in and grow. But if you can't offer basic health care, there's not really a good incentive or care within the workplace.
Yeah. If you want folks to stick around, something like direct primary care is a great option.
Yeah.
It really provides folks with that continuity, the care that they've always wanted in the traditional system, but even despite paying crazy premiums for health insurance, couldn't even get that quality care. And here it is really at pennies on the dollar for just a low monthly fee.
This episode is powered by Foxtrot Print, located here at Workspace Provision Co. at 14101 Capitol Boulevard, right where Wake Forest meets Youngsville. Foxtrot Print specializes in pieces that keep your business moving. Menus, loyalty cards, booklets, thank you cards, and more. As a husband and wife team, we work directly with you to create print that makes an impact and helps your business stand out. I've got 2 boys, a dog, I play music, I run a print shop. Life at home is busy. Trying to grow a business at the kitchen table and run it out of your garage? Forget it. That's why I joined Workspace Provision Co. on the north side of Wake Forest at Youngsville, North Carolina. It gave me more than just a desk and a space. It gave me focus, community, and a place to grow. As a small business owner, having a space like this has made all the difference. If you'd like to grow your business too, check out Workspace Provision Co., Youngsville, North Carolina. With True Insight Direct Care, what is the intake process like? Let's say you're accepting new patients, correct?
Correct.
Okay. And how do I make a connection with you as my doctor?
It's as simple as going to the website. You can peruse through our information and what we do and what we provide. You can also do a free meet and greet. Just sign up for a meet and greet, a little 15-minute time slot to meet with me on Google Meet and ask questions, clarifications, any of that. Then as simple as just joining. There's a Join Now button.
Okay.
That'll take you through the steps to enroll. And then with that, you'll actually get an email and you'll be able to download the app that syncs with our EMR system.
Wow.
And it's all set up that way. You can go right ahead and schedule your first appointment.
I can schedule on an app.
Yeah.
And can I see some of my care and things that
Oh, yeah.
are going on
Absolutely.
via the app?
Yep.
That's awesome. Not only are you available for that direct care to call or text or whatnot that you mentioned, you have the app as well. It's easy to sign up. I love technology. It just makes life so easy. I had a random thought when we were talking about the cost of healthcare versus the primary care service that you offer. GoodRx, you familiar with
I
it?
am, yep.
Why is it that if I go to the pharmacy and I don't use my insurance, a medication, let's say, is $280, but just because I'm standing there and see a GoodRx card that's there and scan that or go to GoodRx and use a coupon code that's on there will make my medicine $18 just because I'm using GoodRx.
I don't get it.
What is happening?
I do not understand. I don't think I'll ever understand
Okay.
how broken the system is.
Yeah.
But it makes no sense to me. And even that's why I started stocking a mini pharmacy on site. To make it convenient. You're right there. You need the medicine, dispense it to you right there,
Yeah.
right for it, and dispense it all in one. But I save people money because we beat prices even compared to GoodRx. Because literally, I look at the wholesale prices, and then I look at GoodRx, and then I even look at some of these corporate entities, what they're charging people. And I don't even understand where the ethics lies there. My heart hurts for folks.
Yeah.
Just setting up the business grant was frustrating in and of itself
I'm
because it
sure.
really just looking at different components of the system and then setting up the business was just eye-opening to
Yeah.
all of the hidden scam almost. It's almost like a scam.
It is.
It's frustrating to know that that's the way it's set up.
Yeah.
That, you just have to know to ask for a discount code or ask for whatever, the pharmacy discount or GoodRx, but it shouldn't be like that. It really shouldn't. There's no reason that it should come down to that.
Yeah.
Hey, do I use my insurance or do I not use my insurance? You might be better off not using your insurance.
That's
To
right.
even know to make that as a choice.
That's
Something, we got to get the word out kind of thing.
That's right. And so I try to be a little thrifty with it. I'll see if it's now granted, there's not many medications that are kind of out of the norm that I have to get, but like maybe one of my children is ill and I need to get amoxicillin or some kind of antibiotic, or maybe something changed for a certain thing. Maybe when he got his tonsils out or something, there was a certain medicine where they're like, oh, your insurance doesn't cover it.
Mm-hmm.
And I'm like, okay. And then I'll say, well, just how much is it out of pocket? And it's something astronomical, like $200, $300, $400, $500 for a bottle of like 10 doses.
Mm-hmm.
And then I say, no, I can't pay that. Let me look it on GoodRx. The pharmacist doesn't even tell you that. Some do a little bit like, hey, they push it across the desk. Here's the GoodRx card. But then it takes this insane amount of money off of your medicine. I know I'm repeating myself, but it just does seem bizarre that little old lady comes in for her monthly medications and they're like $68. $236. I'm just making up random things and I'm like, how is she going to pay $1,000 out of pocket? Maybe she's not aware she can use a GoodRx card or there's other tools or coupons that she can use. And people are struggling
Absolutely
on a monthly, weekly, daily basis because of that.
I mean, the whole industry essentially focuses on patient-centered this and, wellness and improving everything, improving your health and being healthier in America and everything. But we make it near impossible for folks to do that. There's all these obstacles in the way. And that's why I really fell in love with direct primary care.
Yeah.
It's a model. I didn't invent the model. It's been around for a while and it's
Yeah.
gaining more and more traction in the last 10 to 12 years.
Yeah.
But it is a solution for many of the headaches that we encounter on a daily basis with healthcare.
Yeah. Do you make home visits ever to the people?
I can.
Okay. If necessary.
Yep, absolutely. Folks that recently discharged or the elderly folks, recently like out of surgery or things like that, I can go home and things.
That's fantastic. I think of my children watch Peppa Pig still, and I don't know if you're familiar with the cartoon. Okay. Do you have children?
I do.
Okay.
Yep, I have one.
Okay. There's Dr. Brown Bear and Peppa Pig, and maybe it's just traditional or it's different in England or the UK, but he visits the home with his bag and checks on the sick kids. Like that's almost a dying art. It's a thing of the past. It goes in the department with the knife sharpener, the shoe cobbler, the small wholesome business where that's just so lost now.
It is. That's what I like about the ability to have time with patients because although I might not go to every single patient's home, I have that time and that time to listen and that time to really understand the full picture of things. That's what you get from a home visit. And I even recently actually networked with some local physical therapists that go to the home, and there's no extra charge for them to do that. And in fact, I learned that they were having trouble getting the word out that they were an option for folks to local corporate medical offices because, again, they wanted to keep referrals internal.
Yeah.
So some service that can be a huge benefit when someone doesn't have to leave their home 3 times a week to get to physical therapy, corporate medicine was almost putting a block to that information getting out to patients or even the physicians to send a referral their way.
Right.
So the staggering, roadblocks in the way from both a physician perspective of getting the care to patients that that they value and can be a huge benefit versus doing it the old school way, the way it's always been done,
Yeah.
all that.
What about the situations you're in where there's a specific specialty needed? Specific specialty. Is that redundant? I'm not sure. Let's say, for instance, I'm a patient of yours and I need surgery on something.
Mhm.
Do you have your own network of a referral source
I
to
do. I keep a
particular
running
doctors?
list of folks that are either independent, hopefully still independent, because the longer we continue here, reimbursements with insurance and things like that, it's getting more difficult for independent groups to stay alive, so to speak. But I like to keep things independent. Folks, referrals to places that can do cash-based sliding scales or things like that for folks who don't have insurance. All of those, to keep it less corporate-driven and more in the hands of folks who have more of the autonomy to decide and make the best decisions for patients and to work with them. Because there's no patient is identical by any means. That's why medicine really is supposed to be very personalized. It's not supposed to be a cogwheel of churn, getting through the door and in the door, out the door, and on to the next provider and things like that. It just isn't fair.
You're very smart. You're very good at your job, and I haven't even seen you as a patient. I love people that are passionate, that have a drive, that want to you're truly helping others. You're giving them more attention as their primary care, first and foremost. Second, you're saving them money. And I'll add third, you're knowledgeable and you have that care aspect. It's hard to make people care. I'm just saying what you have going on really special. Tell me a little bit more about you and maybe your husband and how you guys operate your business, but also have a home life. You have kids, you have dogs.
Oh, yes.
More than one?
Indeed. We're a dog family.
Yeah, I knew that. And you heard that my dog Romeo was here in the office and you said, is there a dog down there?
Oh, yes. I had to visit.
I love
can't
it.
not.
Yeah.
So my husband and I got together actually when I was working as a paramedic and he was a volunteer fireman.
Oh.
So that's that kind of service background that we have. It's kind of ingrained in us. And we have one son who's 8 years old and a family full of fur babies, if you will.
Love it.
Yeah, we have what was 6 dogs. We just recently lost one, unfortunately. But we have 5 dogs, 2 cats, a hamster, and
nice.
Just a lot of love.
You're an unofficial veterinarian as well, it seems.
Yeah, unofficial for sure.
Yeah.
For sure.
More official than I am, I'll tell you that. What are some names of the pets?
So we just lost Sweet Pea. She was a Basset mix. They're all rescues. They're all mixes.
Okay.
And Sweet Pea was the Basset mix. The next in line is Daisy, who's a Chihuahua blend. She looks like a dwarf German Shepherd, if you will. Third is Willow, and she is a Treeing Walker Coonhound blend by about 60%. And she also has Lab and Golden Retriever in her.
Okay.
Then we have Ivy, Hazel, and last but not least, Buttercup. Buttercup's the only full lab. She was a backyard breeder girl that we rescued.
Okay.
So she's actually a full breed. But all of them are just a bundle of joy. They each have their own quirks and their own personalities. And
quite a blended pet family you have. That's great though. So you and your husband are both selfless and giving, and then even at home you have your pets and you take care of them. That's a lot of mouths to feed though.
Yeah, I would say Chewy knows us by name for sure.
Yeah.
And the drivers who deliver the food for sure. But they get to work out with us.
Yeah. Do they all eat the same thing? Or
they do.
Okay.
Yeah.
You don't have to like portion things out real specific
goodness.
whatever.
We crumble at that point. We for sure crumble. But,
that's great.
We actually bring the dogs in and rotate them through the office a little bit as well.
Okay, good.
And we do have like a doggy gate in the back. If someone prefers not to be around animals or has apprehension with that, we certainly can wall them off and put them in their own area. But a lot of folks enjoy it. It kind of calms them down, even when blood pressure readings, just petting the dog and cooing over them.
Yeah.
Definitely relaxes folks, and we can get an accurate blood pressure reading without that white coat syndrome.
That's great. when I get my blood pressure taken, they're always like, Mr. Paxton, and I get up and I run over and I sit down. They're like, immediately, we have to take your blood pressure. Notoriously, I've had decent blood pressure. It's always around the 120/80 key point, but hopefully you let your patients pet the dog, sit down and breathe for a minute.
Yeah, vitals are like one of the last things I do, actually.
Okay.
Probably in the visit, I probably take care of everything. And then, let's grab your vitals. Like, we've been resting and sitting, we've been chatting and
Perfect.
relaxing.
If I'm at the dentist too, let's say I get a filling or just my teeth clean, and they'll sit me up. I'm one of those people that I need a minute or I'm going to drop, I see stars a little bit. And so I'm like, please just give me a second. They like sit you up. Okay, go down there and see the person at the counter on your way out. And you're like numb and I'm like dizzy. And they're like, so we want to do your next appointment. That's a little side note.
Yeah, you can barely stand up and they're asking you about scheduling something.
Yeah, the things that bother me like that, I guess you hold on to. But can you say a little blurb about how folks can connect with you again? Feel free to spell anything out for listeners so that if they'd like to seek care from you.
Absolutely. So the website's super easy, trueinsightdirectcare.com. And there on the webpage, the front page, as well as in the contact us area, there is that underlined meet and greet. So that link will bring you right to a calendar to schedule just a brief 15-minute visit to ask more questions, to get more information, all of that direct with me. And I actually changed those times recently, so they're in the evening hours, and it's not going to interrupt with work or things like that as well. So that's really the easiest way. And then I'm always available, if businesses want to connect and I can come by businesses, I can talk to their employees. We can set up just a quick coffee, a meeting and things like that to learn more and be able to help employees and help set up something that works out well.
Fantastic. Well, that's a good place to sign off again with the Miss Dr. Courtney Barrett, the head honcho, the selfless extraordinaire of True Insight Direct Care. Did I get it?
You did.
All right.
Appreciate it, Grant. Thank you so much.
Absolutely. I'm Grant Paxton. This is, again, Workspace Podcast, 14101 Capitol Boulevard at Workspace Provision Co. That's us signing out.
Awesome.
Cool.
Thank you, Grant.
A business hub where you can go. It's a Workspace Provision Code. A business hub where you can go. It's a Workspace Provision Code.
Workspace Podcast is recorded at Workspace Provision Co. in Youngsville, North Carolina. If you would like to get involved or sponsor our next episode, email us workspacepodcastnc@gmail.com. I'm Grant Paxton. This is, again, Workspace Podcast, located at 14101 Workspace Provision, Capitol Boulevard. Let me try it again. 14101 Capitol Boulevard at Workspace Provision Co. I've said it 1,000 times. You think I'd have it down by now. That's us signing out.
Awesome.
Cool.
Thank you, Grant.
Thank you.